We kind of talked a little bit more about, we talked about this last time. These are all the different aspects of social media, Twitter, Facebook, all the big players and what they actually mean in perspective. But all these are sort of different ways at which you could, reach out. You don't have to be an expert at all of them. And as Brian had mentioned, you should probably focus, if you are going to look into social media, on maybe one or two different outlets, because it's so hard on top of everything else to, come up with something and go home, write an email to a friend, do a blog site, Twitter post, then video. Triple posting every single piece of content gets very difficult to do. But I want to talk about a couple more people that are actually in this space and doing quite well. So let me kind of go through these names back here. Sorry, the animation loaded kind of funny. So these are people that I would encourage you to take a peek at as far as what they're doing on social media, for good examples. The top one is Bertalan Mesko. He's actually in Debrecen, Hungary. I'm probably butchering that. But he has a course actually called the Social Media Course. It's a Prezi course. It's about 10, 15 sessions long. But it goes in detail. It's a self-directed course focusing just on this social media component. Pretty impressive. I've heard him talk about it. It's a cool course. You can check it out at webasina.com. Kevin Pho is known as Kevin MD. He's known as Kevin MD. He has 60,000 followers. And the three of them, just in general, they post a lot about just technology and medicine, not as much on patient care. Wendy Sue Swanson is probably one of the few people that focuses primarily on patient education, whereas these three focus on things like wellness, focus on being a digital physician, and they have very different levels of followers. But to say that, his 60,000 is pretty impressive, but for people that follow Mary Brandt, her 2,000 followers, they take a lot of what she says to heart. And it's neat when you look at Mary Brandt specifically, because she is not in her 20s, she's not in her 30s. I probably don't know how old she is, so I'm not going to stop there. But she is professor, she's a full professor, she's a pediatric surgeon, which means not a short residency either. Associate Dean of Student Affairs. She's like Dr. Prislin in that aspect. She's Vice Chair of the Department of Surgery. So she's someone in the upper echelons of a very historic institution, Baylor. And she's online, and she talks about wellness. She talks about getting 6 hours of sleep. She talks about sleep patterns. She talks about doing things to make your life as a resident, first year, very useful. That's what a lot of people like about her blog, because that's, for them, very important. And she has a good following. Other people that we can look at here, a couple names: Larry Chu, Brian McGowan, and Mike Sevilla. So the three of them, so Larry Chu is up at Stanford. He's an anesthesiologist. He runs the AIM Anesthesia and Informatics Lab up there, and he started this conference called Stanford Medicine X. Talks a lot about emerging technologies. He's in Stanford, Silicon Valley. I'll send you guys links to all these people so you don't have to worry about writing them all down. There's Brian McGowan, who is a PhD. He talks a lot about how do you QI your whole social media interface for your life. He has a lot of followers. He talks a lot more about theory. And the three of them, and Mike Sevilla, for anyone who's interested in family medicine, he has a radio show on one of the kind of internet radio, a lot of followers, talks explicitly about family medicine, sort of that as a good career choice. I know a lot of the students here know him and follow him along. And I've heard him speak, and a very good speaker. The three of them do a lot more interaction. So if you kind of tweet to them directly or post on their blog, they will repost or reblog back. And it's just a different matter of style. Like I said, Dr. Vardabadian tends to just to give information and put it out there without as much dialogue. These people tend to be doing a lot more dialogue back and forth, and it's really how you want to do that. If you want to just be the nice center point for information, or if you want to engage, it's really up to you how you want to do that. I did want to point out David Tran, who couldn't be here tonight, because what Brian was talking about as far as some of the benefits of social media, how it's no longer a potential liability. So I wanted Dave to talk, but he's on the call tonight. So on his Twitter name, he's listed as medical student, martial artist, and writer, which I don't know if you knew that about David. But he was saying that he's been tweeting a lot of stuff about family medicine. He really wants to go into family medicine. He's been talking a lot about that, going into a lot of meetings. And posts that he's reposted at conferences have now been reposted by residency directors, have been reposted by other people that he's interviewing with, other people that he's rotating with. He's made friends at the California Medical Association. He's been retweeted by them. So as far as like emerging people, that is my Java sound on my phone. That's awesome. As far as people that know him online, even though he has 140 followers, people that know him are people from residency programs that he's trying to get into. And so for them, they're like, wow, this guy is actually pretty savvy with social media. We don't even, he's a third year, he's not even applied yet, and we know who David Tran is. So for him, that's a huge benefit without even really doing this on purpose for trying to benefit him. So kind of neat. And of course, there's my blog up there, and I tend to just put a lot of information out there for people to, read about this intersection of medical education without doing a lot of dialogue. But for me, that's easiest approach. Absolutely. From someone who interviews residents a lot and who interviews medical students, when they get to the point of the interview, oftentimes they've sort of passed the test of, do their numbers meet up? Are they competent enough to be an emergency physician? Are they competent enough to be a family doc, surgeon, dermatologist? And the interview is more about what else can they bring to the table. And so when you go through that, when you read through 300 applications or 100 applications, a lot of it tends to be the same. Everyone who is going to be, say, going to dermatology, a lot of them do research, a lot of them do extensive research, a lot of them are AOA, bright people. And so at times, even though that's a very minor group, they all look identical. And so, things like this are a way to stand out. And so for Dave, I think having, a good backbone of solid skill sets, plus on top of that, when he passes the initial screening and he gets to the interview, they're like, whoa, you're Roll Kick Soul? I've followed your tweets before, I know who you are. That makes an interesting interview. We interviewed someone who built an app that I had used once before for a different project, and I had no connection until I was looking through his CV and saw that he was one of the people who developed that app. I'm like, oh, great, so we spent 20 minutes talking about this app that he developed. But it made me always remember him and have him stand out as someone different than just the other. I always wanted to go into ER because that one time when I was an undergrad and I helped save a life, that kind of thing. It kind of just gives a different context for the story. So because we're running out of time here in the last couple of minutes, I just wanted you to think about some of the other aspects of social media that are beyond just putting things up on Twitter, and just think about what else it can do for an impact. So if any of you have been to a conference recently, there's a lot of this sort of trend in live Twitter feeds, sometimes called Twitter falls, like waterfalls, tweetcasts, simulcasts, and it's actually really cool if you think about it. So it takes the concept that anyone can contribute, and usually on the side of the stage or behind the stage is pretty much a live Twitter feed of the event. And so the event has a hashtag. So if we were in a big course now, I'd say, if you want to talk about the course, use the hashtag Health2Course. And so what they'd put is when someone is speaking, pretty much everyone would take notes on Twitter of the most poignant things said. And so when you watch the Twitter roll that comes down, it's actually really interesting. So like this one here in the upper left, what's next, DC? It's for some other event. But what happens is when you hear a really good point, you'll see that same point sort of get retweeted like 15 times. Or you'll have these little side discussions that happen on top of the real dialogue that's going on that really creates this very interesting dynamic in a discussion. But if you haven't been to one of these or haven't seen one, it's pretty interesting. If you go on Twitter, you'll hear people talk about healthcare, social media. They're going to have a tweet chat. They're going to tweet live from an event. Sometimes you can just not be at the event, but get all the key points from it because everyone's going through. Imagine, if I said something very insightful and you thought, wow, that's really cool, I'm going to write that down. Martin wrote it down, Stephen wrote it down, Aurora wrote it down, and someone else who wasn't there retweeted that because I thought, well, that's cool. So now you have sort of the Cliff Notes version of the super high yield facts from a talk, and a lot of conferences are doing that. Now, I will say, having gone to a medicine conference, an emergency medicine conference, where they did this, was very different from a social media e-patient conference. The medicine conference had about 10 tweets that kind of went up during the session. The social media one had thousands of tweets coming through. So a very different audience, and it just reflected the comfort base. This was a conference for e-patients and tech startups and all the other areas. And so for them, this is old hat. They've been doing this for years. When I saw this, I wasn't even on Twitter yet, and I was like, man, I need to get on Twitter. This seems really cool. And I felt like the Luddite in the room because I had no idea what was going on. Stephen. Well, I think you bring up a couple good points, but I think what Wendy Sue Swanson said in her thing is that oftentimes individual experience is confused for expertise, which I think is a very, if we could retweet that right now, I would retweet that because it's a great quote. Because just because you went through it doesn't mean that's the truth. You hear people like, oh, I had pneumonia and I took baking soda and cayenne pepper and now I'm better. And so that's not the treatment for pneumonia necessarily, but since that person went through it and they got better, for them it worked, but that's an individual experience. And then the other part is, you're right, are we just becoming a collection of sound bites? It's a matter of, again, how you want to be involved in this discussion. Do you want to be involved in the discussion at all? Do you want to use just blogs without even short form, just to say, I'm going to give out information to my population of patients for emergency care about concussions. My thing is going to be concussions. I'm going to write all about concussions at length, but in a way that my patients can understand. That's going to be my piece. What Brian brought up in one of his posts, which I thought is pretty funny, is a great title. It's becoming harder to fake it as a speaker. Now, oftentimes you could read up on something, you've been taught to give maybe impromptu discussions and educating patients, but what he talked about is a conference he went to, panel discussion, people talking about social media, and with these large events, people are like, oh, I don't know who that speaker is, I'm going to look him up, just like a lot of you were looking up Brian Vartavadian, looking at his Twitter feed, and one of the speakers talking about Twitter didn't have a Twitter account. And so on that sort of Twitter fall side piece, everyone's like, how does she know what she's talking about? She's not even online. And so it's sort of there was on the Daily Show or Colbert Report, one of those shows, with all the debates and elections, they made a comment that, fact checking shouldn't be done in the middle of a debate, should only be done after the debate, when everyone stopped watching. It was just sort of a tongue-in-cheek thing, but this is sort of the on-the-spot fact-checking that happens a lot of times with these conferences. Is it a good thing? I don't know. The fact that I'm sure she had a lot of great things to say, this panelist, just because she didn't have a Twitter account doesn't mean she's not knowledgeable, but at the same point, on the spot, on the fly now with any of these sort of events, you have that opportunity to either engage, to approve, to discredit, and it's really a matter of how you want to position yourself with all these tools. And again, the idea is to let you know that these things are out there, not giving you a recipe book to go through, but a lot of stuff to think about when you're at a conference and just to kind of look at these sort of things. The other quick area I want to talk about is social media for public health. I know a lot of you have thought about MPH, dual degrees, disease surveillance. There's a lot of cool things going on with Google Analytics for public health, emergent use of social media for disaster resilience, for disaster response, people talking about certain areas where they need certain items to help out for disaster response. A couple papers talking about in the recent earthquakes and hurricanes how they used social media to pick up on trends and to coordinate loosely because normal channels were not available. Another couple of them looking at the Haitian cholera outbreak. And it's kind of neat with the cholera one that online feeds were a lot faster in predicting trends and surges in cholera outbreaks in Haiti than the CDC was, because the CDC was one agency. They didn't have a lot of people on the ground, whereas they could mine posts about diarrhea, abdominal pain, bloating in different languages and see up spikes in trends and searches, and that correlated with actual the outbreak and the timeline for cholera. Other things too that they're using now for social media, Twitter and antibiotics, again, public health surveillance kind of things. And what they'd look for, they'd search for a couple of key terms, antibiotics, flu season, etc. And it was kind of neat. This one looked at 1,000 different posts that met a criteria of search terms. And of those, cold and antibiotics is sort of an appropriate posting. But then there's flu and antibiotics. That was a third of the posts, which right there you can tell you, well, flu is not going to probably do anything with antibiotics, but that's a third of your population that's tweeting about something that's not really medically sound. Leftover antibiotics. Hey, I took my friend's leftover antibiotics. Is that going to be good? Probably not a good idea. That was 23 posts only. Sharing antibiotics, extra antibiotics. So it's identifying these little trends that kind of pop up. It's just interesting. I don't know what it means in the bigger picture, and it seems pretty new. But there's a lot of things more power than just saying, I like donuts and I work at Google, like we had on that first slide there. And again, here's one for swine flu epidemics, and the cool little graph they have was showing that the darker blue line is the traditional surveillance data that the health agency used, and the lighter blue line is internet queries for influenza H1N1. So it pretty much overlapped relatively well.